So what I'm looking for, again, is I'm testing the length of the IT band, tensor fasciae lata here. I'm going to bring her knee into some flexion. I'm going to lift her leg up. I'm going to widely abduct the hip. I'm kind of quoting the book here, whether it's Kendall or whoever else. I widely abduct the hip. I bring her into a little bit of hip extension. My other hand is stabilizing her pelvis. And I start to let the leg drop. Well, Missy, you're no... Okay? And I look to see how far it drops. This is another time where an inclinometer would be really nice. If the hip stays above neutral, okay, above the horizontal, that's a positive test. If it goes below, that would be negative, okay? On Kathy, what do you guys think about her? And this is her, I'm kind of bouncing here. This is her end range right here. So
almost level.
What would you say? Level. So she's just barely level though. She's just at level. She's not abducted anywhere really beyond that. So we might call this a negative over test, but she is barely, she's almost positive and barely negative. All right? Now this is the thing. If you do this test wrong, this is how you do it wrong. You let the pelvis drop. So this is going to give me a false negative, where I let the pelvis drop and I let the hip go into rotation. You have to control the pelvis. If you're not sure how to do that, then I would just say push down really hard on the pelvis right now and don't let the pelvis move at all. Okay? I can monitor it. I don't have to push that hard, but I can monitor. As soon as you feel the pelvis starting to drop, you've overshot your range of that IT band. So you hold the pelvis here. You let the thigh drop down. You don't let it internally rotate. All right, so you've got to keep. So your hand here is actually doing a lot of interesting things. It's keeping the hip in neutral rotation, and we're letting gravity just pull it down. So modified Thomas test, we'll look at the capsulo-ligamentous structures of the hip joint, as well as the length of the one-joint hip flexors. And it also looks at the length of the rectus femoris. So the way we're going to do this test is you have to, first of all, have your patient sitting with your butt almost all the way up to the edge of the table. So that's step one. So I tell my patient, I want you to sit at the edge of the table so your butt is almost off. So we're good. All right, I just don't want you falling off the table. So step number one is that. Step number two, I want you to grab your left knee for me, and I want you to pull it up towards your chest and go ahead and lay back. And I'm being nice, I'm helping her back. Now the next step is I have to figure out how far up to flex this knee, okay? I'm going to take my hand and I'm going to put it under her lower back. And I bring this knee up. This is what's really important here. I bring this knee up to the point at which I feel her lumbar spine flatten, okay? So right here I feel like the lumbar spine flattens. I now say, hold your leg right there. I look at a couple things. I look at the angle of the hip. If she has normal hip flexibility anteriorly, in terms of the one-joint hip flexors and the hip joint capsule, she'll be able to have 0 degrees of hip extension. Okay? Kathy is normal here. All right? Do you see that? Mm-hmm. If she were abnormal, she'd be up like this. Okay? I am definitely abnormal. I'm up in the air like this. Okay? So that's one thing we look at. We look at the one-joint hip flexors. We look at the hip capsule. We ask ourselves, is the hip at 0 degrees? If her thigh is on the table, she's negative. She's normal here. The next thing I look at is what's happening at the knee. Okay? The knee should be flexed to about 70 degrees, all right, or more. All right? So I would want the rectus to be long enough that it will allow for 70 degrees of knee flexion. If the rectus was very tight, her leg would be staying up in the air like this. It wouldn't be flexed as far. Okay? Kathy is negative. So she has normal rectus length. She has normal hip flexor length, one-joint hip flexor length. So I might say one-joint hip flexors are normal, two-joint hip flexors are normal. So the things about this test that are really critical are A, they've got to be sitting way off the edge of the table, and B, you flex the other leg up just until the back flattens, and no farther than that. Because if you go farther than that, you'll get a false positive. If you don't go far enough, you'll probably get a false negative.